19th June is celebrated as World Sickle Cell Day. For a lot of us in India, we might not even have heard about this disease. What is sickle cell and why is it important to be aware of it? What needs to be done for a patient with sickle cell? I won't go into all the medical details, but what we need to know, because it is World Sickle Cell Day, it is celebrated to increase the awareness about sickle cell disease, sickle cell anemia in our community. Sickle cell disease or anemia is a type of anemia where the hemoglobin is lesser than normal, and it is a genetic disorder, as in it is a defect in the genes because of which hemoglobin is produced in the body. Talk in layman terms, people who have sickle cell disease will have a change in their blood cells or the red blood cells, as in whenever they're exposed to high stress areas like high fevers, low temperatures or hypothermia, dehydration, severe pain and other conditions or severe infection, these red blood cells change their natural shape and take the shape of a sickle. What happens when red blood cells take a shape of a sickle? They're not able to get through blood vessels easily. They end up causing blood clots. The hemoglobin sometimes goes down. They can cause the spleen, which is an organ that's located in our stomach, to grow significantly large. And most of all, it would cause these patients to have a lot of pain, mostly in their small and big bones. Apart from this, patients with sickle cell also have symptoms of recurrent infections. They might have recurrent pneumonias, usually chest infections, and may require a higher number of blood products. There is also a higher risk of stroke among sickle cell patients because, as I said, these blood cells are not able to pass through blood vessels easily, because of which it might block blood vessels and put them at high risk for thrombosis or blood clots. Why is it important to be aware of sickle cell? So, as I said, in India, there are small sects or pockets of sickle cell disease or ethnicities that have a higher incidence of sickle. These are located mostly, some in Odisha, West Bengal. There is a pocket in Nashik. So most of these areas. But since there is a huge mixing of population and migration from one place to another, it's important that whenever you pick up that your hemoglobin is low, usually below the range of 10 or 11, you need to be screened for sickle cell disease or a type of hemoglobinopathy, especially if you don't have iron deficiency or vitamin B12. So once the nutritional causes of anemia have been ruled out or screened, you have to be screened for what we call hemoglobin disorders, which can be sickle, alpha thal, beta thal, and the list goes on. Why is it important for sickle cell patients to know that they have sickle cell? Is precisely for the same reasons I quoted. You might have a slightly compromised immunity. You might end up with pain crisis that has to be managed with strong pain medications, a lot of IV hydration. You might require regular blood products if at all you do have recurrent stroke or recurrent lung infections. You are at a risk for blood clots, so making sure that you maintain a healthy lifestyle and follow the right instructions so that you don't end up with emergencies and don't have to go to the hospital in an emergency. So these are the reasons why sickle cell anemia as an awareness campaign is very important, even in India, where the number of sickle cell cases or patients with sickle cell diagnosis is much lesser compared to Africa, which has the highest number of cases of sickle cell in the entire world. There is also one more entity called beta thalassemia. So when there is a child or patient with sickle beta thal, which is a combination of sickle cell and beta thalassemia, even those children can tend to have a very rough course, as in they will require regular blood transfusions, they will require medications to maintain their iron levels so that they don't end up with iron overload, and some of these patients would also benefit from a bone marrow transplant so that they don't require regular blood transfusions. If you need more information about sickle cell anemia or sickle cell disease, kindly visit our website at Therrapie, and also feel free to contact us for any questions or clarifications at Therrapie Hematology and Oncology Clinic. Thank you.